Hello, dear students. We are back with the understanding or learning of the prescription and medication orders. Up till now, in this chapter, we have learned about what are prescriptions, what are medication orders, what is the difference between those both, what are the things needed to interpret exactly the prescription as well as medication orders. Interpretation means to understand what is been mentioned in the medication order. Once the pharmacist is clearly aware what is mentioned, the name of the drugs as well as the other indications which might be in the form of some abbreviations, those all things we have gone through prior to this point. There are around 164 or more of abbreviations which might be used by the prescribing physician to give the uh, indication to the pharmacist as well as to the patient for a proper use to get the effective treatment or to have a proper effect of the medications. Then in last lecture we have started about the different legal aspects, which are the legal points needed to have a regulatory control over the use of different medications or different drugs while prescribing them in the prescriptions or writing them in the medication orders that we have started. In that we have seen all of the doctors which are called as prescribing clinicians, for example, the MDs, okay, where the patient generally used to go for getting rid of their ailments or diseases, might be acute or chronic, okay. And when these patients arrives at the doctors, they used to prescribe the medications depending upon 5 schedules. Those 5 schedules are having the inclusion of medicines. They are classifying the medicines. Those medicines generally, that is, the classification is generally based on the possibilities of misuse, possibilities of having some habit formation due to their administration. Okay, so depending upon the extent of such possibilities with the medications, they are divided in 5 schedules. The schedule 1 to schedule 5 medicines are there, which again are called as controlled substances. Okay, generally these medications were having certain restrictions. The first schedule medications are the most restrictive, and even the physicians are not allowed to write them in the prescriptions, while from second, third, fourth, and up to the fifth, the even the fifth one can include some OTC products also. Okay, so that's how the variation is there about the control of the use of the such medications depending upon the their severity of the problems, which generally called as habituation, which may occur in the patients. Okay, definitely the physicians should have the knowledge, the understanding of mechanism as well as the properties of all such drugs before writing them in the prescription. Okay, these mechanisms which are generally related with the same just I told, the habituation abilities of the medications, as well as the pharmacist should also be having the awareness about different interactions, okay, harmful or potential interactions which may be arising when the medications were administered along with the other drugs which are simultaneously administered by the patient during the same treatment. So if both the pharmacist as well as physician were using their knowledge and skill to before writing as well as during writing or during the therapy, we will say collectively, okay, it becomes a proper control. Okay, you are having supposed to have a proper uh, regulations for their better use. Further, we know of the thing like all such medications from schedule 1 to schedule 5 were having the highest possibilities of so called as misuse, okay, as well as they were having the potential to uh, worsen different disorder, or they are having the chances to develop certain other problems in the patient, okay, if they are used in more quantity, okay, which is mentioned in the prescription as per the dosing, or if they are administering it for longer time, okay, which is again only said by the physician that for example it is required xyz medication should be required to be administered for only 15 days, and if the patient is taking it for more, there are definitely more chances to have the development of certain harmful uh, things to the patients, which is also called as misuse. Thus, depending upon these misuse or the higher potency of uh, possibilities of developing disorders in the patients, they are having strict or stringent guidelines or regulations depending upon their just I told, okay, the possibilities of or the potency they are having to cause certain problems in the patients, and which is been laid down by the governments at both levels, central as well as the state level, and hence these points are there in the legal requirement in the prescriptions. You have to remind this thing. In exam they may ask, or there might be a question arised in your mind, what is there in case legal aspect. Legally means government has actually developed this schedules, drug and cosmetic act, okay. These acts are been framed by the government authorities, and hence they were having certain rules and regulations for use of such controlled substances in the patients at the different level, okay, national as well as the state level. Further, if the doctor or the clinician is supposed to prescribe such controlled substances, they must have a license. That license is called as DEA, means Drug Enforcement Administration license, and they are getting a number depending upon this DEA, okay, which is registered, and that license number has been mentioned generally in the prescription or the medication order of the clinician, okay, already printed generally. Without this license they are not allowed to write the controlled substances for treatment of patients, the prescribers, while in case of the pharmacist, okay, to fill a prescription, means to, if they are having pharmacy and if they are keeping the uh, so-called controlled substances in their pharmacy shop, okay, they can only be allowed to dispense them or fill such prescription if they are having controlled substance license, and this is the legal requirement in case of pharmacist. Now about the different schedule medications, schedule 1, 2, 3, 4 and 5. In schedule first, okay, the medications which are included or as per the schedule 1 list are called as schedule 1 medication. There are many actually involved in it, okay. Popular example you can see on the screen: the heroin, lysergic acid derivatives, LSDs, and many more are there, okay. These are completely unable to be prescribed, or okay, prescribed by the physician, and means they are not allowed to be prescribed, and no pharmacist can fill them or dispense them because of the indications which are not allowing the doctors to write and pharmacists to dispense. Generally this is there in USA, okay. Similarly it is also used to be practiced in India. Schedule 2 drugs, popular examples many are there, like morphine, codeine, methadone, synthetic derivative, okay, fentanyl, we know fentanyl sodium. These are some of the popular example which are the schedule 2 substances or drugs, okay, which are said to be again highest level of misuse potential, and hence they are needed to be prescribed by clinician. Without the prescription, these all medications are not dispensed, okay. They pharmacists are not allowed to dispense such medications without prescription. These drugs traditionally were only allowed to be filled by paper prescription, okay. This is practiced from a long time, okay. Paper prescription means they are only allowed if the patient is having with them the prescription, a written paper which is called as paper prescription, and only if it is mentioning the name of such drugs, then only they are given or dispensed to them, okay. Traditionally this practice is there. However, they are from 2010, okay, are said to be prescribable by EPCS, means electronic prescribing of controlled substances, EPCS, okay. Depending upon this so called as uh, law or act, okay, they are allowed, the prescriber or physicians were allowed to give certain uh, electronic prescriptions to mention such controlled substances, particularly schedule 2 drugs. About schedule 3 and 4, 5 medications which are prescribed by the clinician via traditional prescription as well as by verbal order, okay, and also by the electronic prescription of controlled substances system. So these medications we have seen that they are having less restrictions, okay. They can be uh, not having that much stricter guidelines to be followed, okay. And uh, by even verbal order, means by telephone or by oral communication, the doctor or physician can ask the nurse or the pharmacist to get the such medications, okay. we are having a list of such medications which are there in these schedules. Schedule 3, ketamine, testosterone, which is anabolic steroid, okay, and many more are there. Then in case of schedule 4, benzodiazepines, you know about benzodiazepine. Then carisoprodol, okay, this is a muscle relaxant, popular muscle relaxant. These are uh, you can administer this without prescription even, okay. And the last one is said to be having inclusion of OTC products also. Okay, see, Phenargan with codeine. Codeine definitely in lesser amount, which is there generally for the anti-tissue products which are there. Okay, cough syrup and many more are there. They were having certain inclusion of antihistaminic substances. Okay, and these morphine derivatives are there, but with lesser extent, okay, which are allowed to be administered by the patient without the prescription also. So we can understand from schedule 1 to schedule 5, okay, how the uh, strictness has been lessening. The electronic prescription of controlled substances, just I told, is was implemented in the year 2010 by Drug Enforcement Administration. Okay, what stated that the clinician might submit a controlled substance prescription electronically. It also stated that pharmacists could dispense these electronic prescriptions simply. So EP means electronic prescriptions. Definitely the physician has to prescribe in electronics through electronic system, means through some software or computer which is there. Okay, they have to submit this such prescription in soft copy, or software are already there by which they are there is a linkage between the doctor and the pharmacist, okay, and the pharmacist similarly can dispense or fill such prescription which are called as electronic prescriptions as per this uh, EPCS. Okay, using this EPCS from a clinician and pharmacy standpoint of view is voluntary, and each party may choose to use the system or not. Definitely this is not compulsory that uh, both doctor and pharmacist are needed to follow such system. Okay, if they are not having the facility with them, okay, they can even prescribe or dispense the medications if they are not having such electronic system with them. Okay, doctors or the practitioners may still write and sign such prescription for schedule 2 to schedule 5 medications if they choose. Okay, verbal orders are only permitted for the schedule 3, 4 and 5 medications. Just we have seen that. Okay, it is compulsory for the prescription, what are called as doctors, to write them and sign the prescription for all of them. Okay, they are allowed, because even not compulsory that only verbally should be done if it is a 5, not like that. One, that is the medications included in the schedule 1, nobody can prescribe, okay, or nobody can dispense. But from 2 to 5, if they are means doctors choose, okay, actually for 2 it is compulsory, but for 3, 4 and 5, okay, they can also write in prescription, or they can also give the order by oral way, okay, by or verbal way. The implementation of this electronic prescribing has significantly lessened the number of different errors. Okay, definitely due to many reasons. Okay, I think in the last lecture or and before that I told that there are chances the handwriting of the doctors, okay, we know they are generally not having good handwriting, or they are not using, might be having good handwriting, but they are due to a rush in their clinics or hospitals, okay, they used to write in some unreadable and handwriting by the patients, okay, only the pharmacists were aware with their handwritings. So due to such problems there might be error occurring, okay, the this electronic system has solved this problem, okay, they can, it can reduce or completely you, there are the chances of the problems has been erased, we can say, like legibility, just I told, means unable to read the handwriting. Okay, even or other possibilities are there about the dosage, how much dosage should be administered for xyz drug, okay, frequency of administration of sub drugs, all these things can be properly solved if they are uh, using this electronic system. And this electronic system is several time having the inclusion of all such things, okay, because of the software which are available, those software can automatically detect the drug, okay, or the name of drug, what should be the dosage, what amount of drug should be taken by the uh, patient, okay, depending upon the control substances. These things are sometimes mentioned in the what it is called as a softwares already, and it becomes easy for both to use them, okay, in effective way. For a pharmacist to dispense a controlled substance, the prescription must include some specific information, okay, and if these all things are included in the prescription, then only the prescriptions are said to be valid, okay. If anything what it is mentioned on the screen, if any of these item if not present in the prescription, the prescription should not be considered valid. So it is the responsibility of so called as pharmacist to see all these things, or responsibility of the prescriber to have the mentioning of all the things in their prescription or medication order. See what are there: date of issue, okay, important thing, because the administration time, the frequency, it is very restrictive, okay, for specific days or specific number of time, definitely in days only it is there, okay, for these control substances, so that has to be mentioned. Definitely the name of patient with address, okay, the name of doctor or clinician with address, and definitely the important thing, drug enforcement administration number, okay, and name of drug, strength of the drug which is there, and what dosage form it is there, then importantly the quantity which is prescribed, how much amount, okay, 10 tablets, 15, 20, exactly it should be there. Then direction, how it should be administered, that is there, okay. Number of refills, refills means, okay, whether the medications are needed to be refilled again if they are going to the pharmacy shop, okay, after uh, complete consumption, or the stock if it is over with the patient, whether the same prescription is allowed to be refilled, so that has to be mentioned in the prescription for these controlled substances. and importantly the signature of the prescriber, which is very importantly needed to be included in the this prescriptions. Now there are certain limits. Okay, just I told there is specific period for which the drugs are needed to be administered. Okay, hence there are certain legal limits which are already mentioned over the prescription or medication order. Okay, depending upon the refills. So those we have to discuss over here. Number dispensed that a prescription may have. Definitely the how many times a single prescription can be used. Okay, generally we are in India, this practice is there with the poor people. Okay, even lower middle caste people, they were also having this practice. If they are economically weaker, okay, they if first time they are going or visiting to the doctor, okay, they are getting prescription for patient after a recovery. If they are having the same prescription preserved with them, the same can be, they are generally using the same prescription if similar symptom arises with the same patient or with the other patient in their family. Okay, and they can they get the prescription, the medication, if they say the uh, with the regular problems which are there, like fever and cough and colds. For such things they are using the same prescription. So generally it's okay for such diseases, but if they are using or if the prescription is having the use of controlled substances, okay, they should not be used again and again unless otherwise it is been freshly written by the doctor or the prescriber. For a schedule 3, 4 and 5 medications, it is mentioned that maximum refills are 5. Okay, maximum you 5 times you can get the medication purchased by using a single prescription. Okay, the limit of quantity is 90% allocation, means only up to 5 maximum times the 90% of the medication which is mentioned in the prescriptions can be refilled. So for example, if they have mentioned 10 tablets, okay, only 9 tablets. Okay, but generally this is not that much strictly followed, but it is said that the quantity 90% allocation which is there. Okay, then there is no possibilities of refill for schedule 2 drugs. Okay, it is compulsory for the patient to go to the physician or to the doctor and get a written freshly written prescription, okay, or newly written prescription. Hence it is said to be zero refill with the schedule 2 drugs. And with the same freshly written prescription, maximum quantity which is dispensed is for which can be used for the 30 days. Okay, that is 1 month. Uh, for more days, that is more than 30 days, drug schedule 2 drugs are not allowed. Okay, the quantity used will not be in excess which can be used for more than 30 days. So that is all about the legal requirement about the prescription and medication order. How uh, the government or different organizations in different countries were having the control over the use of such controlled medication or controlled substances which is there. Okay, so hope you have understood all these things. The other things regarding the same point will that is same chapter will be discussing in our next lecture. Thank you, take care, bye.